Hello there, and welcome. If you're watching this, you're probably getting ready for your sinus surgery, and we put this guide together just for you. We're going to walk through everything you need to know about your procedure, which is called FESS. The goal here is simple, to answer your questions and help you feel calm, confident, and ready for this big step toward breathing easier. So let's start with why you're even here. That feeling of constant pressure, the stuffiness, the infections that just keep coming back. It's exhausting, isn't it? When chronic sinusitis starts getting in the way of your day-to-day life and it feels like you've tried everything without any real, lasting relief, well, that's when it's time for a real solution.
Okay, so before we talk about the fix, let's do a quick refresh on what we're actually working on. Your sinuses. They're basically these little air-filled pockets inside your skull. Think of them as a natural air filter. They make a thin layer of mucus to trap dust and germs and keep everything clean. But when they get blocked up and inflamed, well, that's where all the trouble starts.
And that leads us to the big question. Why surgery? Why is FESS the right path for you at this point? It really comes down to a few key reasons why this becomes the best and most effective option when other treatments just haven't been enough.
Look, surgery is never the first option. It's the right option when things like chronic infections just won't quit, or when you have growths called nasal polyps blocking things up. Sometimes it's a structural issue like a deviated septum. FESS is designed to get to the root of that problem, to actually fix what's causing all the misery, not just mask the symptoms.
Now let's talk about something incredibly important, the person who will be performing your procedure. Knowing you're in the hands of an expert is one of the best ways to feel at ease. So let's introduce the specialist who will be taking care of you.
Your surgeon is Professor Dr. Ahmed Nofal, and I really want you to see the incredible level of expertise we're talking about here. He's not just a consultant, he's the head of the ENT department at Ream Hospital. He brings more than 2 decades of hands-on experience to the table. And see that credential? Fellow of the Royal College of Surgeons of Edinburgh? That is a huge deal. It signifies the highest level of surgical training and competence. Most importantly for you, his specialty is exactly this, minimally invasive endoscopic sinus surgery.
And if you want to put that experience into numbers, here it is. Over 4,000 advanced surgical procedures. Just take a moment to let that sink in. That's thousands of patients, so many of them in the exact same spot you're in right now that he has helped. You are in truly skilled and incredibly practiced hands.
All right, so you know the why and the who. Now let's pull back the curtain on the what. Understanding what actually happens during the procedure can make a world of difference in feeling prepared and less anxious. The first thing you need to know is that FESS is a modern, really precise, minimally invasive procedure. So any old ideas you might have about surgery, you can just set those aside. Today's techniques are all about being incredibly effective while being as gentle as possible on your body.
And this right here is probably the most reassuring thing for most people. There are absolutely no external cuts, no incisions on your face at all. The entire surgery happens through your nostrils, which means no visible scars and a much smoother recovery.
So let's walk through it. First, you'll be comfortably asleep under general anesthesia. Then, Dr. Nofal will use something called an endoscope. It's a very thin tube with a tiny light and camera on the end to see inside your nasal passages with amazing clarity. Using tiny, precise instruments, he'll then carefully remove whatever is causing the blockage. The whole goal is to simply reopen your natural sinus pathways so they can drain and ventilate properly again, just like they were designed to do.
The surgery itself is just part of the journey. What happens after is just as important. So let's lay out your roadmap to recovery so you know exactly what to expect and when.
We can break down your healing into 4 main phases. The first 24 hours, you'll feel totally blocked up. Then, that eases into a period of partial blockage for about 10 days. Day 10 is what we like to call the turning point. And by about 6 weeks, you're looking at the final result. Let's dig into each one. Okay, for that first day, your nose is going to feel completely blocked. That's because there will be some packing inside to manage any bleeding. So, you'll be a mouth breather for about 24 hours. We want you to be prepared for that. It's a totally normal and temporary part of the process.
The day after your surgery, that packing comes out. Now, for the next week or so, your nose will still feel kind of blocked because of the natural swelling from healing. You'll also see some blood-stained discharge. Please know, this is perfectly normal. It's a sign that your body is doing exactly what it's supposed to do to heal.
And now we get to the good part. Around day 10, you'll come in for a follow-up, and any small internal splints will be removed. We call this the turning point because this is when you'll start to feel a real, noticeable improvement in your breathing. It's a fantastic feeling.
Now, even though you'll feel much better around day 10, full healing on the inside takes a little more time. Your body's tissues need to finish their recovery work, so that final amazing result, the absolute best breathing you're going to get, that's usually achieved at the 6-week mark. A little bit of patience in this last phase goes a long way.
To help you get to that 6-week milestone feeling great, your role in your own recovery is absolutely essential. Following these care instructions is the best thing you can do to guarantee a fantastic result. So let's go through the big ones.
Think of this as your game plan. On the do side, regular nasal washes are key. They keep everything clean while it heals. Rest with your head propped up, take your meds on schedule, and please, don't miss your follow-up appointments. On the don't side, it's all about avoiding anything that increases pressure or swelling. So no heavy lifting or tough workouts for 6 weeks. Steer clear of super hot showers or saunas, and try to keep direct sun off your face.
Okay, this is important. While complications are rare, you need to know what to look out for. Call your doctor's office immediately if you have heavy, bright red bleeding that won't stop with gentle pressure, a high fever, any weird swelling around your eyes or changes in your vision, or if you're having real trouble breathing. Your team is here for you, so never ever hesitate to call if you're worried.
Your entire experience, from the procedure to your follow-up care, will be right here at Ream Hospital. It's a world-class facility, and the whole team, led by Dr. Nofal, is completely focused on your safety, your comfort, and your successful recovery.
And that's our walkthrough of your FSS procedure. We hope you're feeling more prepared. Remember, this is so much more than just a surgery. It's the beginning of a new chapter, one with clearer breathing, better sleep, and a better quality of life. Your journey to breathing easier truly does begin now.